Currently, if you see, she has a facial asymmetry. She has an issue with the upper jaw growth. There's a collapsed occlusion. The surgery will make it better, but we're not able to give her a totally precise bite.
The plan is for the jaw correction, and it's a BIJAW surgery. It's dual jaw correction. So stage 1, we are planning for the rotation of the mandible.
The lower third as well. The chin is moved to the right side. There's swelling on the right side. There's hollowing out on the left side. Sorry. Mudichu. You can see how it was come out more on this side. The chin, the entire face was queued up. The middle third and the lower face. And now you can see this has come out. So we have this girl, and she's having secondary deformities post primary cleft surgery. She's got surgeries in many places. I've done some revision procedure for her years ago. Currently, if you see, she has a facial asymmetry. She has an issue with the upper jaw growth. There's a collapsed occlusion. That means the bite is not so good. So here we're going to correct the bite, and we're also going to correct the jaw position and thus the facial aesthetics and the facial balance. I'm going to be doing a combination of an osteotomy and a distraction osteogenesis both at the same time. We'll be rotating the lower jaw towards the left side in such a way that the midline is achieved and the bite is improved, and this asymmetry that's pretty much in the lower third of the face corrected. As far as the middle third of the face goes, we're planning an anterior maxillary distraction to go along with the BSSO and a rotational advancement or rotational movement jaw surgery, right? That's a plan. Everything is going to be done from inside the mouth. We're going to be making a splints, and we're probably going to schedule her tomorrow. Thank you. So each is the way of day. No, but you can correct it a little bit more, because only then this will get corrected. Just rotate it fully by at least a centimeter or so. Each area. So this midline should be there. It's more than 3. Twisted, get occlusion. We'll do it, and then agade, and then standard AMO, AMD. We'll do another one. I don't think BIJAW is a good idea.
Right side is collapsed around.
Loose, yeah, that's why we'll do this only. Because definitely the upper jaw needs to come forward. It's hollowed here. But get the upper jaw forward by 1 centimeter, rotate it in such that there's a positive overbite relation. Yeah. So our doctors have already prepared the cast. That's a bite. So you can see this. It's not the ideal bite. There's literally 2 teeth here and 3 teeth here that's touching. Now the surgery will make it better, but we're not able to give her a totally precise bite. That will happen once we correct the collapsed arch and get the teeth in proper shape, which will be done a few months after surgery. So this is surgery first approach. We're going to get the jaws in the first position, first place, in the right place. Thereafter, orthodontist is going to get in and put the teeth in the right place. Why are we doing this? Because in her case, the deformity is severe. We want to save time. This is a procedure that works faster for patients. It works better as well. So that's the plan for her. You can follow her up after surgery, and maybe also after a few weeks as she comes for reviews. Thank you.
everyone. We are here with a patient pre-operatively, that is before a jaw surgery. So when we look at her, the first thing which is very striking is facial asymmetry. When we draw the facial midline, which starts from the line which is the forehead, crossing the glabella, the nose and the chin, we see the chin prominence is towards her right and it's deviated to a quite apparent extent. If I ask her to bite, just bite, show your teeth. Yes. So this is how her bite is. Where I am pointing is exactly her dental midline, which is the two between the two central incisors. So a dental midline corresponds here, while the chin, as we can see, is completely rotated towards the right. She has her jaw, the lower jaw, which is rotated and slightly prognathic, and that's also because she is a cleft patient. So if you close your mouth, we see the scar. This is because of the cleft lip repair which has been done elsewhere in her childhood. She also has a cleft palate, which has also been a palatoplasty she has undergone elsewhere. She also needs a rhinoplasty, but probably in the later stages, and also dental rehabilitation. So this time the plan is for the jaw correction, and it's a BIJAW surgery. It's dual jaw correction. So stage 1 we are planning for the rotation of the mandible. This is because of asymmetry correction, and also to compensate for the cleft maxillary hypoplasia, it is going to be distraction for the upper jaw. So it's a lower jaw surgery with a rotation and an upper jaw for advancement. We'll see as to how the surgery goes in the OR, on table, and also before she leaves. Thank you.
Come this side, man. Smile.
So this is the patient before we started surgery. You can see her facial asymmetry involving the middle third, clearly on the lower third as well. The chin is moved to the right side. There's swelling on the right side, there's hollowing out on the left side. There are issues with the bite as well. We're going to show you one more view where you can appreciate the issue with this patient. You can see the asymmetry even extending up to the lower border, the lips and all. So we planned a BIJAW surgery. This is her right now. There's a lot of swelling in the lower lip because of traction, but we fixed the asymmetry. As you can see, we've planned a rotational osteotomy. So once the swelling gets down and once the distraction is completed, she's definitely going to have much more harmonious face, a face that has much more correct proportion, and also obviously no asymmetry. Before and now. Okay. We have a pre-op. Sorry. Mudichu. So we've just done BIJAW surgery for her. This is day 5. It was a facial asymmetry correction, jaw surgery, both upper and lower jaw surgery. And Nera, sorry. Nera paru, killa va. Kannadi pidichuko. Odar moodi vai. And so we work on the lower jaw, and this was really protrusive. We've taken it inside, we've rotated it, and so we've taken it inside asymmetrically. Then we worked on the upper jaw, brought it forward, and we're also going to put it on some braces treatment after a few months, and by that time the occlusion will settle. In a while we're going to show you how she looked before we started. Come. So you can see that there's a huge issue. You're now seeing the side view where the lower jaw seems to be sticking forward, and she classically has an underbite, so to say, in layman's terms. But you look here, that's the dental issue that also we're going to do finally. And that's the asymmetry you can see. The lower jaw was twisted out, and that has been fixed as well already. There's still swelling. Look at this now. You can appreciate once again the asymmetry. You can see how it was come out more on this side, the chin, the entire face was queued up, the middle third and the lower face, and now you can see this has come out. So we've worked on the upper jaw, worked on the lower jaw, angle, cheek, and this is still early days. It's just 5 days up. Side la parma. One more time, the side view for you. You can see this. And the front view.